I'm going to be using this pillow as my patient today. So right off the bat, I've determined that the scene is safe and I have my gloves on. I have my one patient who is right now lying in a supine position, and depending on the mechanism of injury, which I'll learn from either the patient themselves or the bystander or even what's going on around the patient, I'll have my partner hold C-spine and apply collar. So I'm going to determine the level of responsiveness. Hi there, my name is Amiden. I'm with the ambulance. Do you mind telling me what happened? So the patient is speaking to me, so I can tell if they're an A on the AVPU scale. They're being articulate. I am, because the patient is speaking, I can already tell they have a patent airway, and I'm going to assess for the breathing. So I'm going to listen to the breathing sounds. I'm going to watch for the chest rise and fall, and the patient doesn't complain of any difficulty breathing. I don't see any use of accessory muscles right now. Depending on the circumstance, I may listen to lung sounds as well. I'm also going to take the pulse of the patient, so I'm going to take it up here, and then I'm going to take a distal pulse. And I am going to do a capillary refill check, and because this is a hypotensive patient, this is a shock patient, I'm going to assume that's going to take more than 2 seconds. And then while I'm doing this, I'm going to also determine the quality of the skin, if it's cool and clammy. I think it might be, because again, this is a shock patient. I'm going to then go down the body with my gloves and check for any bleeding. Okay, I don't see any bleeding right now that would indicate that I need to use a tourniquet. Nothing seems life-threatening so far. And because this is a cool and clammy patient, I'm going to say this is shock, maybe hypovolemic shock. This could also be psychosomatic shock as well, though, but I will treat the patient regardless. So first, I'm going to lift up the lower extremities of the patient about 6 inches, and I'm just going to place this box underneath them. And then I'm going to cover the patient with a blanket, just to ensure that the patient will become hypotensive as they try to regulate their body temperature. And I'm going to reassess this patient every 5 minutes.